Hello, everyone. Welcome to today's topic and today's talk, that is lymphocyte immunization therapy in pregnancy, or ImmuLIT in pregnancy as we call it as per our branded procedure. I am Dr. Mohan Raut. I am a practicing gynecologist and clinical reproductive immunologist. We have our centers, Dr. Raut's centers for reproductive immunology in different parts of India. We have our main center in Mumbai, and we have centers in Pune, Nagpur, Bangalore, Hyderabad, and Delhi, and a few more centers are in the pipeline. At these centers, we treat couples with unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility using immunomodulatory treatments like lymphocyte immunization therapy and other immunomodulatory medications. These centers are reproductive immunology centers, and we don't do IVF procedures ourselves. So, coming to today's topic, lymphocyte immunization therapy, or ImmuLIT or ImmuLIT in pregnancy. Now, all of you know what is lymphocyte immunization therapy. As the name suggests, it's use of lymphocytes to cause immunization or immunomodulation, and it is an active immunomodulatory procedure used for couples with reproductive failures. Now it uses lymphocytes to induce certain type of protective antibodies and protective protective antibodies are called as asymmetric antibodies or blocking antibodies, and the protective cells are called as T regulatory cells. And with the help of these two cells and antibodies, there is protection of pregnancy. It tends to create an environment like the natural protection of pregnancy, and therefore the effect of lymphocyte immunization therapy lasts longer. It is more effective, and since it mimics natural protection, it is a safer procedure than the passive immunomodulatory treatments. And how does it work? So these lymphocytes, as I said, they act as an antigen because of the CD200 markers. Now, conventionally or traditionally, lymphocyte immunization therapy is given before the patient is pregnant. Patient who has history of miscarriages, IVF failures, or unexplained infertility. In non-pregnant state, she is investigated. If the investigations indicate that immunological alloimmune problem exists, that is lymphocyte cross-match negative, TNF alpha is raised, changes in the natural killer cells, endometrial CD57 positive, then that couple is given lymphocyte immunization therapy, and after that, after 4 weeks, the couple is given lymphocyte immunization therapy. But can it be given in pregnancy? Here I would like to share one small story. One couple came to our clinic, referred by our teacher. She had history of 6 unexplained miscarriages, and madam had sent her. The entire family had come with her, with their husband and wife. That is, the mother-in-law, father-in-law, brother-in-law, sister-in-law, all were there with her. And madam called up and said, Mohan, I'm sending this patient with 6 miscarriages. She is already pregnant. She was 5 weeks pregnant. And I'm sure we can do something for her and see that whether lymphocyte immunization therapy can be used for this patient, because I don't want her to abort for the 7th time. So we investigated the couple, and I'll tell you what happened after that. But coming to our topic for today, that whether lymphocyte immunization therapy can be used in pregnancy. Now, in pregnancy, if the couple comes with the history of miscarriages or IVF failures or unexplained infertility, and she is already in early pregnancy, lymphocyte immunization therapy can be done after doing the required test. You can't directly give. So, if the immunological investigations indicate that she requires lymphocyte immunization therapy, then lymphocyte immunization therapy can be given in early pregnancy also. So, basically, as soon as the reports are available, the procedure of lymphocyte immunization therapy is done. The way do we do it, it's a one time 3 hour procedure. So as soon after the reports, the LIT procedure is done, and the couple is immediately started with the passive immunomodulatory treatment. You know that we always combine lymphocyte immunization therapy with an individualized protocol of passive immunomodulatory medications. So that is usually given when the couple starts planning pregnancy, when LIT is given in non-pregnant state. But here, immediately after LIT, the post LIT protocol of immunomodulatory medicines is started. Now, usually we wait for 4 weeks because we allow the immunological response to develop, but it has been seen that the immune response starts immediately and starts gradually building. So, even in pregnancy, if it is given, the immunological effect starts on the pregnancy and the protective effect is there immediately after the LIT. So, in patients who have this past history, lymphocyte immunization therapy in pregnancy is also useful. We after that patient, what the patient which story which I told you, her investigations indicated that she required LIT. We gave her a lymphocyte immunization therapy and the immunomodulatory treatment, and her pregnancy was uneventful, and she delivered a healthy baby at full term, and that was a normal delivery. So, friends, the uh, lymphocyte immunization therapy is equally effective when it is used in pregnancy. All of you know that the average success rate associated with lymphocyte immunization therapy, as shown in different research studies across the world, is between 75 to 85%. In our center, our success rate is close to 80%, and the same thing is seen when it is given in pregnancy. Okay, so the so this is about the efficacy when we use in pregnancy. But the important thing here to discuss or to say is the safety part. Many patients and doctors ask us when we are giving this in pregnancy, they say, is it safe in pregnancy? Are there any side effects? So there are large studies which have been done by late Dr. Caroline Coulomb and also by Kling from Germany, which they have done a long-term follow-up of patients who have been given a pregnancy lymphocyte immunization therapy. Then in the meta-analysis done by Liu in 2016 and by Cavalcante in 2017, they have shown that LIT is equally effective during pregnancy. In fact, in the meta-analysis of Liu and Cavalcante, they have shown that LIT can have better effect if it is given before and during pregnancy. So that's what their study had concluded. But this coming to again the safety part, it has been all these studies have studies of Kling and Dr. Caroline Coulomb have shown that there is no increase in no adverse effect on the baby. There is no increased incidence of IUGR or even preterm delivery in patients who have been given lymphocyte immunization therapy even during pregnancy. There is no increased incidence of hyperbilirubinemia in the baby or even thrombocytopenia in the baby. So, LIT procedure, whether given before pregnancy or during pregnancy, is equally safe. There are no chances of severe allergic reactions like anaphylaxis. So, in conclusion, lymphocyte immunization therapy is an effective treatment for patients who have unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility. It can be given in pregnancy if the patient presents with who is already pregnant and history of miscarriages. And one more thing which I would like to share before the last part of my conclusion, and that is it can be used even in patients who have threatened abortion. Now, we have treated at least 5 patients who were referred to us with bleeding in early pregnancy with history of multiple miscarriages in the past, and we have given them a single dose of lymphocyte immunization therapy during pregnancy with history of bleeding. And in fact, one patient was sent an ambulance to our center. We treated the patient, and subsequently the patient did well. So even in patients who have threatened abortion where everything else is normal, and the lymphocyte immunization therapy can play an important role in saving the pregnancy. So friends, the lymphocyte immunization therapy in non-pregnant state and in pregnant state has the same efficacy, and it must be considered whenever you come across patients who have history of multiple pregnancy losses, or they have conceived after multiple IVF failures and failures, uh, and there is no cause found, then immunomodulation can play a very crucial role for successful continuation of pregnancy. Thank you so much. If you have any doubts, any queries, you can send to our helpline number 9833201522, and we will get in touch with you immediately. So thanks for joining this live session, which was today was live on Facebook, LinkedIn, as well as on YouTube. And see you soon with some other aspect of lymphocyte immunization therapy and its efficacy. Thank you so much.